Okay, so I guess we'll start then. Maybe shall I record this?
Yeah.
It's going already. Okay. So welcome everybody. So this is the educational seminar on shortcut learning. So it's going to be given by me. I'm Andy, in case you don't know me, and Akshit, who's sitting over there. And we're going to be talking about shortcut learning. And I guess the first thing to say is that actually Akshit knows a lot more about shortcut learning than I do. So I'm doing the easy bit at the beginning. I'm just going to explain what shortcut learning is and give some examples, and then he'll talk about the harder stuff later on, the more interesting stuff. So to get my So I would like to start off with a question for you guys. Is this a dog or is it a cat? The cat. Anybody think it's a dog? Everybody thinks it's a cat. So you're correct. It's not a trick question. It is a cat. It's not surprising to us to know that this is a cat, but maybe the surprising thing is that it's really easy to get and to train an AI model to say that this is a dog. And that's kind of what this seminar is about. I'm going to explain how that can happen, and then actually it's going to try and say some things that we can do about this problem. So I'll come back to this example in a minute, but this is just an overview of what we're going to talk about today. So I'm going to talk about what's shortcut learning, how does it occur, examples of shortcut learning, and its links with demographic bias. That's me. And then Akshit will talk about sort of things that we can do about it. How can we detect it? How can we characterize it? And what can we do about it? So let's go back to this example. So why would AI get this this task wrong? It would be trained with a bunch of pictures of cats with the label cat, and it will be trained with a bunch of pictures of dogs with the label dog. So its training data is all correct. It's not being given any misleading information. So why, when it gets to the test data at inference time, why would it get things wrong? And I guess the first thing to remember is that AI is kind of good at cheating. It will try and find any possible features that are linked to the target label that it's been given. Okay, partly that's why AI is so powerful. It doesn't need to be given the features to look at. It doesn't need to be told where to look in the image. So it will just try to find anything which is correlated with the label. And sometimes that's really helpful. Sometimes that can lead to really powerful performance, but sometimes it can have problems. So this is a subset of the training data that was used to train this model. And I wonder, can anybody tell me why do you think it got it wrong based on this training data? Yeah, so the dog is this dog is in the background. Color of the animal could be the color. This is just a subset. I mean, there was a lot more training data than this. I think George was along the right lines, actually. If you look at this data, both of the dogs are outside and both of the cats are inside. Now, it's obvious to us what's a dog and what's a cat, but actually, if I try to explain to you how to tell the difference between a dog and a cat, it's kind of difficult, really. They both got 4 legs, they're both a bit furry, they both got eyes, they both got ears. So it comes down to quite subtle distinguishing features. But I can easily explain to you how to tell the difference between indoors and outdoors. If you see grass, it's outdoors. If you see furniture, it's probably indoors. Okay, so things like that are much easier for the deep learning model to pick up on than to learn these difficult discriminative features between dogs and cats. And so that's what the model went for. It was given this data, all of the data had cats inside and dogs outside. So it says, right, as soon as I see an inside background, I'm going to say it's a cat. As soon as I see an outside background, it's a dog. And we can inspect what caused the model to make that decision by using interpretability techniques. So GradCam is one example of that. And this is the example that I showed you on the first slide. And we can see with this heat map, the heat map is showing most of the focus of the attention of the model is here. So it's seen something in that area of the background, which is discriminative. It looks like it's something which is outside. And you can see it's not really looking at the most discriminative part to us is probably the face of the animal, isn't it? And it's not really looking at the face of the animal at all. So it's learned this sort of spurious feature to discriminate between what it thinks discriminates between dogs and cats. And that works fine at training time. And it leads to really, really good performance because that association between the target label and this spurious feature was there. But as soon as that association is broken or reversed, then it leads to poor performance, poor robustness. And this is what we mean by shortcut learning. So it's a phenomenon in which AI models learn to solve a task based on these spurious correlations or spurious associations present in the data, as opposed to features directly related to the task itself. So I'm going to give a few examples of this from the literature. The first one is a very famous example, which is you see in almost all papers on shortcut learning. And this is the Waterbirds dataset, which came from this paper back in 2020. And in the Waterbirds dataset, the task is to classify the type of the bird. And it's either a water bird or a land bird. And so we're going to define that as this target label Y. And we also define another attribute, and the attribute is the thing which might be leading to the shortcut. So it's the potentially spurious attribute. So we'll call that A, and in this case, again, it's background. So is the bird on a picture of water or land? And you can see that the training data has almost entirely water birds on water and land birds on land. And then when you come to a test example, you get a water bird on land, then it gets it wrong every time because it's not learning to tell the difference between the birds. It's quite difficult to tell the difference between a water bird and a land bird. It's much easier to look, for example, for the color blue or the color green. So this is a famous example. It's one of the first examples that was reported of shortcut learning. And as I say, it's a common benchmark data set. So every time you see a paper on shortcut learning coming up with a new mitigation algorithm, almost certainly it will have the Waterbirds data set in there. Another famous example that people use to illustrate shortcut learning is the wolf and husky example. So this is not a public data set, a benchmark data set, so you don't see it in experiments so much, but whenever people try to introduce the idea of shortcut learning, they quite often talk about this data set. And this came from the paper back in 2016, so it's quite an old concept, this. And this is the paper that introduced the Lime interpretability technique quite a few years ago. So this time the task is to classify between wolves and huskies. And this time the potential spurious attribute is the background snow or not snow. And the training data had wolves on snow background and huskies on non-snow background. And of course, the model learned to associate the background with the target label, the spurious attribute with the target label. So as soon as it saw snow, it said it was a wolf. This paper also did quite a nice and interesting user experiment where they basically started off showing a bunch of humans the image and the AI prediction of whether it's a wolf or a husky, and they were asked, do you trust this output or not? And to begin with, because I can't tell the difference between a wolf and a husky, to be honest, and most of us probably can't. So to begin with, they trusted the output of the AI model. They said, yeah, that's probably correct because I don't know any better. But then they repeated the experiment and they also included these Lime interpretability maps. So here you can see the colored parts are the bits where it's attending to, where the model is looking. And as soon as you provide these interpretability maps to the subject as well, then they stop trusting the model because they can see that it's not even looking at the animal's face. It's just looking at the snowy background. So this is quite an interesting way of illustrating the impact of shortcut learning. I'll give you one more example from the vision literature. So you've probably heard of the Celeb data set. So this is a database of pictures of celebrities, and it comes with lots of other information about each picture. And a couple of the pieces of information are hair color and sex. So you can construct a data set and a task here in which it's easy to get shortcut learning occurring. So in this case, we've just defined the task, the target label as hair color, either dark or blonde. And the spurious attribute this time is male or female. So you just train the model with data where all of the blonde-haired people are female and all of the dark-haired people are male. And it's easier to do sex. Well, it turns out it's easier to do sex classification than hair color classification. And so when you get given a male with blonde hair, it will incorrectly say that that person has dark hair. This was from the same paper that did the waterbirds example, by the way. And this was a paper that proposed a method called group DRO, group distributionally robust optimization, which is a method for dealing with shortcuts and biases. And I think Akshit's going to mention that briefly later on. So I can almost hear you thinking that these are, it's all very well. So shortcut learning is a thing, but these are all a little bit fake examples, aren't they? So nobody really wants a waterbird, landbird classifier. Nobody wants a dog or cat classifier. Nobody wants to know what color hair celebrities have got using AI. So these are data sets and benchmarks that have been constructed purely to illustrate the phenomenon of shortcut learning and to evaluate methods for dealing with it. But they're not real. Nobody wants these models at all. So the obvious next question is, are there real examples? When you come to real world examples of AI, can shortcut learning occur and is it a problem? And that's where I think you need to move into healthcare and medical imaging in particular. So this is one of the first examples of shortcut learning in medical imaging. So this is from dermatology. So this is back in 2019, where they investigated a CNN for doing binary classification of skin lesions as either a benign nevi or a melanoma. And you can see examples of the two here. And they took a model that had been trained. It was a pre-trained model. It had been trained on more than 100,000 clinical dermatology images to perform this task. So they didn't artificially construct the training data of this model. It was an existing model that people were using. But they wanted to find out, does this model have any shortcut learning? Now, in clinics, quite often, if a dermatologist is suspicious about a lesion, if they think it's potentially cancerous, they mark it. They'll get basically a pen and they'll put some blobs next to it. And these blobs get included in the photos. So you can see here that this is a benign nevus, which has some marks next to it, these two blobs here. And this is a melanoma, which has 3 blobs. So they just put sort of pen marks next to the lesion. And as I say, these get included into the data. And so what they wanted to investigate in this paper was, are these markings potentially acting as shortcuts? So they evaluated this pre-trained CNN on 3 different test sets. So they didn't change the original model. They just constructed 3 different test sets. One where they used an unmarked dermatology image, so just the lesion. One where they kept the markings in there, and one where they cropped around the lesion. So these two obviously don't have the markings, and the middle one does have the marking. And then they evaluated the performance of this model. And what they found was that there was a higher chance of being classified as a melanoma if the markings were present. So let me explain these box plots here, first of all. So the vertical axis on all of them is the probability of being classified as a melanoma, as a cancerous lesion. And the 3 box plots are for the 3 different test sets, unmarked, marked, and cropped images. Now, these two here, in situ melanomas and invasive melanomas, these are both melanomas. So you would expect there to be a high probability of being classified as a melanoma if it is a melanoma. And you can see that across all 3 models. All 3 models correctly identify melanomas. But the interesting part is these 3 here. So this is if the ground truth is a benign nevi, what's the probability that it will be classified as a melanoma? And here you can see that when there is no marking there, it's quite a low probability. When the image is cropped, it's an even lower probability. But when the markings are there, you get a very high probability. So it's associating the presence of these markings with being a melanoma. And that's because dermatologists, when they're suspicious about something, they mark it. And when they're suspicious about something, it's more likely to be a melanoma. And you can double check that with some more interpretability maps. So this is the GradCam interpretability maps for these images at the top here. And you can see here that when it's unmarked, you can see that the attention of the model is looking mostly at the lesion. When it's marked, you can see there's blobs here and here, which correspond to these markings here. And again, unmarked, it looks at the lesion. And then another example here where it looks at these 3 blobs around here. Yeah.
It's related to the fact that the marks somewhat resemble a melanoma. it's more to do with like if marks are an identifier?
I don't know the answer to that question. I don't know if you. Yeah, yeah.
So it's not just something that looks like it, it's just an identifier. Okay, thank you.
So there's another example that maybe is similar to the one that you just talked about there, actually. So that was kind of a simple example. It's a real world example because this is a model that had been trained. It wasn't trained artificially, so it's a real world case. But the shortcut turned out to be quite simple and straightforward. This is a more complex example that was published maybe 5 years ago now by De Grave et al. And this was a model for diagnosing COVID from X-rays. And they had 2 data sets. And they basically trained models using each data set individually and then evaluated it cross-domain and looked to see what was this model using to make its decisions and what was its performance. And they found quite a few examples of shortcuts in this case. So one thing was related to patient positioning. So if you look at these highlighted bits in the table down here, you can see that one data set had a low percentage of COVID positive cases and the other one had still low, but much higher. But this one here had lots of AP images, which basically means the X-ray was taken from the front to the back. And the alternative is that you take it from the back to the front, and that changes because of the attenuation and the magnification. AP images and PA images look different. Okay. So AI models can probably tell the difference between AP images and PA images. And if they're associated with COVID output labels, then the model was using that sort of signature as a shortcut. And so it turned out that the model was associating the presence of an AP image with COVID negative. So it was more likely to classify something as positive if it was a PA image. There were other shortcuts that they found. So one of them is related to what you just said. So X-rays sometimes, but not always, have these little markers in the corner of the image, which basically just say things about the image. Sometimes it says what's left and what's right. And they leave these in. Nobody takes them out. And so here you can see this is an interpretability map showing where the model is looking. And you can see you expect it to look in the lungs because that's where you should see changes in opacity in the lungs to diagnose COVID. It's almost not looking in the lungs at all, but it is looking in the corner here where there's some writing. And it's even looking at the diaphragm, which is not at all related to COVID. So there's a couple of examples there. There were other examples that they found. I'm not going to go through all of them, but there were site-specific artifacts related to the imaging acquisition protocols, even age. So you can tell what age somebody is roughly from an X-ray, or AI can tell what age somebody is, and older people are more likely to have COVID. So in this case, there was lots and lots of shortcuts going on. They were all interacting. Some of them applied to all test data, some of them only to a subset of the data. Sometimes the shortcuts were diffuse, sometimes they were localized. They were sometimes overlapping with each other. Sometimes they were overlapping with the task relevant features. So it was a very complex picture. And this is interesting, I think, because when the shortcut is simple, we can identify it just by looking at a drop in performance and a few GradCam maps. And we can see that it's not looking at the dog or the cat. So it's quite simple to diagnose and to explain those shortcuts. But when it's complex like this, we don't currently have good enough tools to be able to describe and characterize all these different shortcuts. This links with Akshit's PhD, so he's going to be talking a bit about that later on. I also wanted to mention there was quite a nice use of generative AI for shortcut analysis in this paper. So here they basically trained I think it was a generative adversarial network to translate from COVID negative to COVID positive images and vice versa. So the left bunch of figures here are going from negative to positive. The right bunch are going from positive to negative. And you can see some of the features that are introduced. So some of them are pathology related features. So the blue boxes are showing changes in opacity of the lungs. So these are related to COVID. So it had picked up on some pathology related features. But the red boxes are illustrating things that are not related to pathology at all. So you can see There's some boxes in the corner here where there's markings. There's even bits of background down here. You can see this laterality marker here. So there's lots of things going on in the data, basically, and it's not all related to pathology. Okay, so they're examples of shortcut learning in general. I want to say a little bit about the relationship between shortcut learning and demographic bias. So kind of in parallel to the shortcut learning literature, there's been a whole bunch of literature looking at fairness of AI. So by fairness or bias, I mean just different levels of performance for different demographic groups. So you might have a disease diagnosis model and it works better for men than for women because it saw more men in the training data. That's a known phenomenon and people have been looking at that for a number of years now. And I would say that actually this is just an example of shortcut learning, but it's an example of shortcut learning where your spurious attributes, the A that I talked about earlier on, are associated with demographic attributes. So in other words, when these shortcut features are associated with demographics, then shortcut learning leads to bias or lack of fairness. So to illustrate this is some of Akshit's work from last year. So he looked at demographic bias in Alzheimer's disease diagnosis from MRI. And basically we were trying to answer two questions here. Is there a difference between brain MRIs based on sex or race? So can AI identify race and sex from brain MRI? Because that's kind of a precondition of demographic-based shortcut learning. If there is no difference between race and sex in terms of their brain appearances, then there are no features for the shortcut learning to pick up on. So this is basically trying to answer the question, are there any spurious features here for it to pick up on? And secondly, when training with imbalanced data by demographic attribute, can we observe performance bias in Alzheimer's diagnosis? So the answers to these two questions are, first of all, yes. So we can identify sex and race from brain MRI. And you can see here across a range of different data sets, ADNI, OASIS 3 and HCP, across a couple of different models, we're getting performance consistently in excess of 0.8, mostly in excess of 0.9. So AI can easily identify somebody's race or sex just from a 3D image of their brain. So that's the precondition of having potential shortcut learning, demographic-based shortcut learning. So then the next question is, does it occur? So if we train an Alzheimer's disease classification model using sex and race imbalanced models, data, do you observe shortcuts, basically? Does it affect the performance of the minority group? And the answer to that was also yes. So this figure here is basically showing the difference. So each red or blue line is showing the difference in performance of a model that was trained on imbalanced data from a model that was trained on balanced data. So if there was no shortcut learning happening at all, they should all be on this straight line here. But what we're seeing is that some groups are doing better and some groups are doing worse. And it's the ones that are doing better are the ones that were consistent with the association that was seen in the training data. So it's using the shortcut. So shortcut learning doesn't always result in drops in performance. It can result in an increase in performance as well, if that association is there in the test data. But we're also seeing drops where the association was not there. So as I say, I think demographic bias is really just a subset of this broader phenomenon of shortcut learning. And it occurs when there are, first of all, demographic specific features which can be identified in images, and when there is imbalance in the training data. And the final thing I think I wanted to talk about was shortcut learning and segmentation. And I put that in quotes there because I'm not convinced it's really the same thing. But we know bias can occur in classification models. Almost all stuff on shortcut learning is on classification models, but bias has also been observed in segmentation models. So we did some work a few years ago where we trained CMR segmentation models, cardiac MR segmentation models, using racially imbalanced data. And we found out that the models perform much better on the race on which they were trained. So if you trained it mostly on white people, it will perform much less well on Asian or Black people. And we've seen similar phenomenon in skin lesion segmentation and prostate segmentation from MR as well. So the question then is, if bias in classification is just an example of shortcut learning. Is bias in segmentation also just an example of shortcut learning? So in this case, what we found from an investigation using interpretability was that the bias was caused not by anything to do with the heart. So this is the heart here, and you can see there's very little attribution in the heart, but most of the attribution is around the edge of the body. So it's related to fat composition, body fat composition. But the features are far from the structure of interest. So you might think, well, that's exactly what shortcut learning is. It's finding something in the image and it's using it to sort of identify something. I think it's kind of slightly different in that in shortcut learning, it's using a spurious feature to directly classify its output label, and its output label is a single attribute. Whereas in all segmentation models, I think contextual features are used. Obviously, you need to look at the thing you're segmenting to be able to segment it well, but all segmentation models also use contextual information. And if they're used to seeing a particular kind of feature in the contextual information, then you'll get good performance if those features show up in the test set. But if those features change, let's say there's less body fat around the edges, then it won't have those contextual features to pick up on. So it's kind of a related thing, but I don't like calling it shortcut learning in segmentation because I think it's not quite the same thing. I prefer calling it like spurious associations causing segmentation bias. So I'm going to stop there. I'll just give a brief summary. So shortcut learning involves the use of spurious features rather than semantically meaningful features. It's present in vision benchmarks, but also in medical imaging tasks. In medical imaging, shortcuts can be multiple and more subtle, making them more difficult to address. And interpretability tools can be used to audit for possible shortcut learning. And the obvious next question is, what can we do about shortcut learning? I'm not going to talk about that. I'm going to hand over to Akshit for the second part. Oh, yes.
Identify disease, and the model is looking at something that we didn't think had anything to do with it, but then actually it turns out that it does.
Yeah.
Been able to gain insights from it. I guess maybe then it wouldn't be kind of shortcut learning, but
Yeah. I'll just repeat the question for people online. So somebody was asking, are there cases where shortcut learning has been useful? So it's discovered new features. So I think I agree with your own answer to your question. I'm sure that's happened because AI, it picks up on whatever features it can find. And sometimes they may be things that doctors haven't thought of, and it might provide useful information. I wouldn't personally call that shortcut learning. To me, shortcut learning is a bad thing. It's using something spurious, where I would say that's almost like knowledge discovery, really. But it's the same phenomenon, I agree.
Is there a way to distinguish between something that's spurious and something that's more like causal? For instance, like in the COVID X-rays, saying that the diaphragm is not related could actually prove to not be.
So that might be more something that Akshit's going to talk about. So maybe I'll leave. Maybe if you find that his talk doesn't answer your question, ask it again at the end. So you use this keyboard to move on to the next slide. Let's see.
So, hello, my name is Akshit, and I'll be talking today about detection, localization, and mitigation aspects related with shortcut learning. And like just to continue, like on the last question that was asked. So in case there are features that are often useful for the task, but are not directly related to the anatomy. But one of the things that helps us answer whether it's really a shortcut or not is whether these features are generalizable or not. Imagine like we test this particular model on a general data set which is separate from the training distribution we had. Will those features still be relevant to the task? So if that's like if the answer to that is yes, then it's not necessarily a shortcut. It could be a useful feature that's not related to exactly the anatomy that we are looking at. So that's something I think of. Okay. Yep. So we'll be starting with detection, and we'll discuss first an out of distribution test, which is like a common test to like understand whether we have performance disparities using the model. Like from the model we have, then we will test common metrics associated with fairness and bias, but it helps us to understand if a particular feature is potentially causing shortcut learning, because we can then use that feature to compute these metrics. Then there are like a couple of approaches, case studies that we will study, which where we will see like how in specific problems shortcut learning is detected. We'll go from there to localization. Localization is primarily interpretability based. So we will see like what are the drawbacks associated with the current interpretability tools, and like how much can they be used to actually get a meaningful signal associated with shortcuts out of the setup we have. And then finally, how do we mitigate these biases introduced by shortcut features? So this is an out of distribution test, and here we have a training set, and we have like stars and moons, and we can see like there are left corners, bottom left and top right stars are present, and bottom right and top left moons are present. So if the test set is independently and identically distributed, so it has like the same uh, distribution where we have like stars on top right and bottom left, and similar for moons we have the same distribution, the model works well. And instead, when we present like the model with a with an out of distribution test set where we have stars in the opposite locations and same for moons, the model fails. So this is a kind of test that one would typically do like at first to establish that there are biases, like that there is a potential of shortcut learning. These are some common metrics associated with fairness, but I think like if we know like the particular attribute of interest that we are trying to like the particular attribute of interest which could cause shortcut learning, these might help in understanding whether that's like causing some performance disparities or not. So I will start with demographic parity. It basically means like given the associated group, so if there are like males and females, what is the probability of success? It stems from economics normally, where like there are hiring systems that are algorithm based, and people want to understand like whether there's a discrimination between male and female candidates, even when their credentials are similar. So it's basically mentioned like computing the difference in probability of success. And we have conditional statistical parity. So in this case, we have like a latent factor involved as well. So for instance, like along with males and females, we have another factor like saying, let's say how many of them are old or young, and then we just consider that as well when computing fairness. So we compute like like again the difference in successful outcomes for these subgroups. And then like typically in classification setups, or even like in deep learning setups, the more common like the more common metric is worst group accuracy. So let's say our data set has 4 different subgroups, like male having disease, healthy males, females having disease, and healthy females. So sorry, there's a typo there. And just we can find the worst performing subgroup here. So we will compute accuracy or any kind of a metric for each of these subgroups, and we will report like if we see like a disparity between, let's say, the average accuracy versus the worst performing subgroup, that's a concern. Uh, Now I'll present like a case study for like this. Here's a paper that studies chest X-rays and tries to understand like the potential of shortcut learning. So we have chest X-ray images, and we have these tasks: eclectus, effusion, and abnormal classification. These are 3 different classification tasks. And the example shown here is an effusion classification where we see like the model can be biased based on the age. So like the model could like miss out on predicting effusion in young patients as opposed to like older patients. And so this particular figure is actually like restating something Andy also mentioned earlier, that we have to have a precondition that an attribute, which is age in this case, can be identified from the image. And it's also associated with the label, that is that the effusion labels and like young or old uh, kind of a distribution aligns with the uh, with the attribute. And then in that case, like if the route that's taken is through the attribute, we would say that it's potentially a shortcut. Uh, so the study shows that across all the three tasks, the model can like get a reasonable performance. So firstly, like clinical prediction is reasonable, and it can also predict age. So the like X to Y and X to A can be done. And the test that they did was to bias the data set. So here's a biased version of the data set where no effusion patients had, like subjects had an age distribution that's on the left, lower age, and effusion were older patients, as opposed to a balanced set where like the mean age for both the distributions was almost the same. They applied gradient scaling. It's basically a multitask. So the core idea is we have a multitask learning where we are learning both the tasks, that is a fusion or any like other classification tasks, and then we are also having an age related head where we are trying to predict like the age. So what they tested was like if we change or just the contributions of the learned gradient from the age classification part, how does this like affect the age prediction of the overall model? So we can see like the if we improve the contribution of age gradient, we can see like it reaches a lower bound of 6. That's the mean average error. So on average, the difference in predicted age is 6, and the upper bound is around 12. So this is the impact of gradient scaling. And then like in terms of fairness, we can see like on the x-axis, we have the fairness computed on this classification task. And when we like negatively scale the age gradient, when we are trying to like predict less of age, the fairness improves. But it also makes the task suffer in this particular case. And in the balanced case, what we have is like a balanced data set. So like age doesn't improve fairness, it just like drops the overall performance of the like age encoding is basically not harmful in this case. And that's the kind of studies that people can do. Like if you have a doubt on specific attribute distribution differences, can be first synthetically introduced, and then using approaches like gradient scaling, we can see whether fairness separation and task related performance differences are useful or harmful. In case they are not harmful, we can still like that's a case where it's not a harmful shortcut. In the same paper, they also show that there can be unfairness in other situations where uh, like where the attribute is not really the reason for that. So here's another example. In the last part, we studied like how we can use the optimization part of the model training, trying to do gradient scaling, but people are also interested in understanding like the representation level, the representations inside the model, whether they are biased or not. So here's a synthetically biased data set. First setting is no bias, where like the task is disease and healthy classification, and there's no bias. In a morphology bias data set, we introduce more bias to the subjects which have disease and less to the healthy ones. And similarly, there's another type of bias, morphology and intensity, where we try to introduce more bias in the disease subjects as compared to the healthy ones. And the idea is like we have a convolution network feed forward for classification. We take like different layers or blocks, and from every image in the test set, we do PC on that and get like the top k uh, components that would capture the maximum variance present in those layers, and then basically that there's a lot of the next slide will show the kind of analysis that has been done. So here we can see like different blocks for morphology bias dataset and for the no bias dataset. And principal components often so it's the y-axis here is the number of principal components, and the numbers indicating are the accuracy of disease prediction and the bias prediction. So bias prediction is basically whether there was a morphology bias or not, and in this case disease or not. So with 5 principal components, the disease can be predicted, and with 9 principal components, this bias can be predicted. And this is like sort of consistent across the morphology bias data set. Across the no bias data set, we can see like the on the second column of each of these blocks, the accuracies are very less. So the first thing that we understand from this is like bias is actually encoded in the hidden features, and then we can come back to our out of distribution test. So basically, like disease classification accuracy measured on aggregate data shows that the morphology bias and the other morphology and intensity bias trained models are better at predicting disease. But when we actually test it on out of distribution like setup where we see like the difference in subgroups using the delta true positive rate and false positive rate, these are very high for the bias data set. So this first establishes that, okay, the bias could cause performance disparities. And this particular figure is showing like, so these, the numbers, the accuracy numbers that I showed were from a logistic regression model. And the the figure here shows the boundary or like the decision boundary at the probability 0.5 using the first principal component of use for training the logistic regression model. The core idea is, like, without getting more into the details, that in the bias data set, the separation is clearer for for some subgroups as opposed to the other subgroups. And this is like essentially telling us that this kind of separation that aligns more with the bias is being used as the signal for prediction. So uh, now we have like checked a few cases of how we can detect the shortcut learning, and now but it still doesn't answer like what features in the input. Often in medical imaging, we are interested in finding out what features in the input are actually uh, used like by the model to make these decisions that are harmful. And we have like attribution methods that are used in interpretability to sort of get pixel space attribution, where we get an importance score specific to a class. And examples are GradCam, layer-wise relevance propagation. There have been concerns about these methods, which are like sort of mentioned in this work by like this work mentioning like sanity checks for saliency maps, where they discuss like the common ideas are if we have attributions from for the entire uh, image, like if I remove the highest attribution region from that particular image, does my prediction stay the same? So that tells us like whether the attribution is faithful or not to what it's giving to us. And there are a lot of science checks similar to this that can be done to first establish whether we are getting attributions that are reliable or not. Now, attribution methods like are typically summarized using qualitative analysis. We cannot look at the entire test set and see the attributions to tell if there's a shortcut reliance. There could be recurring patterns, but even like if we have, let's say, thousands of images in the test set, it's difficult to do a qualitative analysis, and that's not a feasible option to reliably detect like localized shortcuts or spurious reliance. So I would not call it shortcuts yet until it's causally validated. So the other part that works have shown is like we can cluster these raw attribution maps and get some sort of recurring patterns across the test set to see like what are the common patterns. The drawbacks are still that raw attribution maps could be noisy. Like when we retrain a model again and again, the reliance could change, and therefore averaging like clustering on that could be reliable, well, it could not be reliable. And then it still needs human in loop because there's no post hoc analysis on top of these clustering methods that can tell us whether there's a signal for shortcut or not. So like I'm now going to share like some parts of our work, ordinal scoring correlations for attribution representations. So here I'll first talk about the problem setup. So we have three different types of models where we have like a biased model first. We assume that this model could be biased by a specific attribute that is known to us. So for instance, like gender can be a shortcut for a hair color classification task in Celebi dataset that Andy had shown previously. And so we are suspecting that this model relies potentially on facial features instead of like the hair color itself. Then there's a baseline model which has been trained on a balanced data set, and the balanced data set has like like it has equal representations of both hair color and both the genders in this particular case. And then there's an attribute model which is specifically trained to classify the gender. So here's an example of how the attribution maps from LRP look. So the baseline model is looking at the hair color, like hair region, whereas the test model which we have biased by the attribute gender. So in the data set for the biased test model, we had like put majority of one gender on a specific hair color like blonde and majority of other gender on black hair color. That was the setting we had. And then we have attribute classification, which is used to like identify the gender itself. And we can see like the contrast that baseline relies on hair and the test and attribute models rely on facial regions or like some parts of clothing. What we do is like this could be noisy like across different model trainings or across different examples. This could be like, for instance, from like instead of the left part of the hair, it could go to the right part, or like it could focus on different face features. What we do is like we try to reduce the attribution. We try to tackle the attribution noise by ranking the attributions present in each of these like images. So that's for each model, we rank the highest attribution regions per image. So what we get is like three different ranked lists. Right? So, sorry, not organized. But we get like highest to lowest rankings for the attributions from these three models. And what like our idea is that the baseline model will rank regions that are related to the task higher as compared to the test model and the sensitive attribute model. And the sensitive attribute model would rank the regions that are higher for associated with the attribute. So we try to like so going back to our figure, we had these three like we had sensitive attributes, we had images, labels, we had three models, we did compute attributions on these, we got like rankings from these attributions. So we aggregated these attribution ranks for the entire data set. What we can do is like now we can compute correlations using these three ranked sets. What we can like the first correlation here is the partial correlation where we uh, condition on the baseline. So we want to remove the task associated regions and only keep the bias model relevant regions and the sensitive attribute relevant regions. And we can see like the aggregate on the data set highlights like the brighter regions here means more reliance or more importance. And we see like the face region is highlighted more in this particular partial correlation. And on the opposite side, we have like the other kind of correlation where we are trying to find like still like what is the good part about the test model. So we have we condition on the sensitive attribute, find the common parts on test and baseline, and we can see like the hair region has higher importance in this case. So that's the idea. And we show this across different model retrainings to like demonstrate that the signal is stable. What's the final outcome? So we can compute different types of correlations, and on the x-axis we have like increasing amount of balance or decreasing amount of bias for different models. The core idea is that like the decreasing bias, our correlation values are also decreasing, the cleanest being the partial correlation. And this is sort of mimicking the kind of performance disparities we will get when we have lower bias in the model. So if we have like if the bias reduces, the performance disparities across subgroups will reduce, and similarly like the correlation shows the same. Now coming to the mitigation. So we've studied like whether we can detect shortcut learning, whether we can localize reliance on spurious features that we know about, and what can we do about it? There are like the most common approach that like not the most common, the very common approach is group DRO, which is basically an optimization approach which stems from the Minimax optimization family. The core idea is like in every uh, batch, we take the worst performing group and we minimize the loss for that. And there's a star to that we need good regularization and early stopping along with this so that the model doesn't perform very badly. And these results show that ERM is basically standard cross entropy using the like given population we have. And then DRO results show that across different data sets, the performance is better. Then we have adversarial optimization. Idea here is that we try to maximize the task prediction and minimize the attribute prediction. So methods more or less in this particular domain, they try to use this particular equation like loss of task minus lambda loss of attribute, or like the adversarial attribute that this is the adversarial component. We can increase or decrease the lambda like based on how much harmful or useful it may be for the task. And then there are augmentations. So here the example is like we can see dog images. So a common augmentation approach is to try to crop different objects and paste it on the on this particular image to break the object context co-occurrence. So if like the spurious feature was the background for dog, and it was a different background for the cat, then if we paste the cat image like cat face on top of the dog, and then it's like breaking the co-occurrence. It improves the performance slightly, and like it's shown to be better than like other approaches like cutout, where we just remove that, and mix up, where we mix like both the objects together. So these are some of the common approaches. Like now I'll just present a recent work on shortcut detection and mitigation. So in this case, like till now, whatever cases we have discussed, we knew about the shortcut attribute, whether it can be age, it can be gender, sex, but or race. But in this case, like let's say we do not know about the attribute that's causing shortcut learning. That's that's again a start to this, because the work presents it as mitigating bias without any subgroup labels, but they do have a probe set which they use like as a held out data set that they suspect might be containing a shortcut. So basically this probe set, taking the example of waterbirds, we try to construct a set such that uh, we have waterbirds and landbirds both with the water background, and the model predicts both of them as waterbirds. So we try to find examples where class prediction is the same, but the examples like but the class predict is the same, the true class is different, but the background context is being used. Sort of that's the rough idea. We try to find like conflicting examples, and the first part uses an existing trained model. Encoder of that gets the features. This is the shortcut detector. That's the core part of their approach. The shortcut detector like projects this particular embedding like from the encoder of an already trained model, and this embedding is projected to a low rank kind of a subspace. The idea is like after it this let after the shortcut detector outputs a representation, the classifier should still predict the same class, same incorrect class. So let's say the input was land bird on water. The initial prediction was waterbird. We use this shortcut detector. We get the low rank subspace output. We pass this like low rank projection. We pass this projected embedding again to the same classifier we had. This h of theta 2 is basically the classifier head, and then we should still get waterbird as the prediction. What it's telling, like, so what we are learning is essentially from this projection, can we get the shortcut relevant features from the latent space? There are other approaches that are disentanglement based. They try to suppress one feature and take other feature, but this is sort of trying to do that with a projection based approach. So in the next phase, what they do is like now they have this shortcut detector. The shortcut detector tries to like now we have two different embeddings from the model. One is the original embedding, another is the spurious embedding from the detector, and this one is related to the shortcut. Now we can apply the adversarial approach that we saw before. try to maximize the prediction from the original embedding and reduce from the spurious embedding. And that's the mitigation that they're doing. And they show like state of the art results as of 2025 on different data sets. And like these are just some ablation studies that they do. Like this lambda is basically the ratio of like they multiply lambda with loss of original divided by loss of spurious. And if they increase this, the worst group performance improves. They have other types of regularizations. So might be an interesting read. That's all. Thank you.